If you see someone who might need CPR and you're not alone, tell that person to activate the emergency response system. Then, place the patient flat on their back. Once you're next to the patient, it's time to get your hands ready to do CPR. Locate the xiphoid process at the bottom of the patient's rib cage and measure 2 fingers up. Or, you can use the patient's nipple line and place your hands in the middle of the patient's rib cage along the sternum. Begin compressing at a rate of 100 compressions per minute. Notice that one hand is on top of the other, fingers are interlocked, and the palm of one hand is what runs along the patient's sternum. When administering chest compressions, position your shoulders over your hands. This will allow each compression to be deeper and more effective. Quickly assess the level of consciousness of a patient and look, listen, and feel for signs of breathing. Ensure that the patient has a clear, open airway and administer 2 breaths, and quickly check for a pulse. If the pulse is inadequate, begin cycles of administering 30 compressions followed by 2 breaths. At no point during CPR should compressions be halted for more than 10 seconds. In place of a bag valve mask shown earlier, a face mask may be used instead. As with the bag valve mask, ensure that the patient has an open, clear airway. Then place the mask over the patient's nose and mouth and create an adequate seal. If no airway device is available and you feel comfortable, you may give mouth-to-mouth breaths. Remember that adequate time should be allowed between breaths for the patient to naturally exhale.